Dr. Jade, and today we are talking about the top 5 chronic diseases that are reversible with weight loss. The top 5 chronic diseases that are reversible with a healthy weight. As always, drop in the chat. Where are you guys joining from? Any questions you have about the topic we're going over tonight, drop that as well. If you're new here, I am Dr. Jade. I am a board-certified family medicine and obesity medicine doctor. I am in Las Vegas. My private practice is Inspire Primary Care. We are a membership medical practice. That means we do not bill insurance in our practice. We serve 5-star quality primary care to the Las Vegas Valley for a flat monthly or annual membership. So if you're in the Las Vegas area and you've been looking for a primary care doctor that is going to treat you like family, help you with chronic disease reversal and prevention, and help you with your wellness and weight loss, look no further than Inspire Primary Care. We are serving up high quality primary care in the Las Vegas Valley. And if you have not heard of a membership model, it is one of the best, most effective ways to provide quality primary care. So, all right, let's get into it. 5 chronic diseases that are reversible with a healthy weight or weight loss, all right? And this is what we are doing here with our medical weight loss program and our wellness program here at Inspire Primary Care. So number 1 is type 2 diabetes. Type 2 diabetes. So type 1 diabetes is an autoimmune disorder that you'll typically be diagnosed at a younger age, okay? Versus type 2 diabetes is an acquired insulin resistance that we typically see in adults, and it is linked with, one, there can be a genetic component, but it is often linked with obesity as well. All right. And so as we start to transition to a healthier weight, lose weight, the resistance of that insulin decreases at the pancreas, and we are able to see type 2 diabetes be reversed. And it is my pleasure, and I absolutely love seeing those hemoglobin A1C levels with the labs come down and helping my patients to decrease and safely transition off of diabetes medications. So that is an incredible reason to join our medical weight loss program at Inspire Primary Care. If you are a person who has type 2 diabetes and you are tired of medication, for that, consider our medical weight loss program to help you transition to a healthier weight and reverse that type 2 diabetes. All right, number 2 chronic disease that is reversible with transitioning to a healthier weight is hypertension or high blood pressure. Okay, so many of our patients join the practice and they have elevated blood pressure. High blood pressure is very linked to having an increased weight or being obese or overweight. And as we start to help our patients, as I start to help my patients decrease and transition to a healthier weight, we also start to see that blood pressure transition to a healthier range as well. I have patients often join the practice that are on 2 or 3 blood pressure medications or even on 1 blood pressure medication, and they ask me, how can I get off of this? And a big part of that is transitioning to a healthier weight. Now, many of these chronic diseases are what we call multifactorial, where there could be a genetic component, there could be a lifestyle component, there could be a weight-related component. They could be in something called metabolic syndrome, where there are several different things contributing to why they're experiencing having a chronic disease. However, one of the key and common factors that are related to these different chronic diseases is obesity and being obese or overweight. So as we transition, oftentimes blood pressure does transition to a safe range, which is another reason to join Inspire Primary Care's wellness program, which is included in our primary care membership, or to upgrade to our medical weight loss membership, where we utilize medications to expedite the results of weight loss. All right. Chronic disease number 3. I see y'all joining. Where are y'all joining from? I'm joining from Inspire Primary Care here in Las Vegas. Drop it in the chat. Any questions you have about chronic disease reversal that we're talking about today, our medical weight loss program, Inspire Primary Care, and drop in the chat where you're from, all right? But chronic disease number 3 that can be reversed with transitioning to a healthier weight is hyperlipidemia, also called high cholesterol. Same thing. So many of our patients want to decrease their heart attack risk, want to decrease their stroke risk, which transitioning to reversing their high blood pressure and reversing their high cholesterol will both decrease that risk of heart attack and stroke. So we're concerned about that, right? So again, transitioning to healthier weight helps to decrease that cholesterol panel, and that is what we are doing here at Inspire Primary Care with our wellness and weight loss programs, all right? And now, chronic disease number 4 that can be reversed with transitioning to a healthier weight is obstructive sleep apnea, also called OSA. So if you are snoring at night very loud, if anyone else has ever told you look like you're choking or gasping for air, if you are tired throughout the day and you're not sure why, you may have something called sleep apnea. Also, if you have high blood pressure and you don't know why, you also may have obstructive sleep apnea. So a secondary cause of high blood pressure, a common cause of people having high blood pressure is poorly controlled sleep apnea or obstructive sleep apnea. And the word obstructive comes from literally your body not being able to get enough air. And as we become more obese and have more body mass pressing down on us when we're horizontal in the bed, that obstructs our ability to fully get air in and out of the lungs at night when we're laying horizontal, hence obstructive sleep apnea. There can be other obstructions within the throat and neck, but the most common reason people have obstructive sleep apnea is because of increased weight. So as we transition that weight to a healthier weight with our medical weight loss program or our wellness program at Inspire Primary Care, we are seeing obstructive sleep apnea reversed. We are seeing our patients being able to come off of their CPAP machines at night, which is very exciting, or not have to undergo a sinus procedure, surgical procedures with ENT to help correct these obstructive sleep apnea concerns. So last one, guys, number 5, reversible chronic disease when you transition to a healthier weight is obesity itself, you guys, obesity. So it is so important for us to realize, and this is why I went and got additional certification in obesity medicine, is because obesity in itself is a chronic disease. And oftentimes we look at being overweight or obese, there's so much stigma attached to it. We think of it oftentimes as if you just get your habits under control, if you just eat less and move more, that it'll fix all your problems. And that's not always the cause. That's not always the total picture. Sometimes there is a genetic component that also automatically contributes to our struggles with weight at different stages of life. We also have different metabolic components that we definitely have to have in consideration when it looks at this. So this is also a chronic disease. And when we approach it in that way, just like we would high blood pressure or high cholesterol or any of the other chronic diseases, then we can take a full approach looking at the components that we can control, which is what we do with my Inspired Health method, putting my patients on a personalized wellness plan to look at the aspects that are under our lifestyle and habits control, right? Which people ask me all the time. You tell me about the medical weight loss program. What is it? There are 2 parts. There's the wellness component, the personalized wellness plan, where we look at your nutrition, your sleep, your stress, how much you're moving, and we look in detail and we create a personalized wellness plan and tailor those goals monthly. Okay, that's one part. And the second part is adding medication, weight loss medication, to expedite the results. But I tell everybody that the weight loss medications, the ones we have on the market now, are extremely effective. The average weight loss is about 15 to 25% of weight loss, which is as close as we can get to surgical gastric bypass, which the average weight loss with gastric bypass is 30%. So the fact that our medications can get us up to 25% of weight loss non-surgical is a huge medical breakthrough. So I tell people all the time, the medications are extremely effective and they can help you lose the weight, but they do not help you keep the weight off. Check out one of my last lives, because this is a common question. Do I have to be on medications forever if I start weight loss medications? My last live, I went through all of that in detail, so check that out. But there are basically 3 options. You can discontinue the medication once you're in the maintenance phase. You can choose a as-needed dosing to help you stay in your healthy weight range, or you can continue a long-term or lifetime low dose to that's a third option. So there are lots of options. They're tailored recommendations. You should definitely be following someone who is certified in this, who specializes in this. And if you're in the Las Vegas area, look no further than Inspire Primary Care. I am so passionate about this because of the chronic disease reversal. Of course, we want to look good. We want to feel good, right? We want to look good in our clothes. However, so many diseases, chronic diseases, and health-related impacts are related to elevated weight and being overweight or obese. So if you have any questions, drop them in the chat. I do free video meet and greets. You can go to the link in the bio, click that if you have questions about joining the practice. Schedule a virtual meet and greet with me. We are a little over halfway full at my practice. So if you are in the Las Vegas area and you would like to join our membership medical practice, now is the time, all right? And that's at inspireprimarycare.com. No I in front of Inspire. There's an enroll button shaped like the Las Vegas sign. You click it. It takes you through the steps to join the practice. And it has the link built in there to schedule your first appointment. So it's very simple and seamless, okay? Teresa says, thank you for the information. It is my pleasure. If you guys have any other questions, I'm just checking the comments to see if there's any other questions. Otherwise, I hope you all have an amazing weekend. And tell your friends and family in the Las Vegas area, now's the time to join Inspire Primary Care. I'll see you guys next time. Bye.